Good afternoon. Thank you very much for the organizing chair for inviting me to Istanbul to share our work as well as research in acupuncture in cancer care. I come from Memorial Sloan Kettering Cancer Center in New York City. It was founded in 1884 as the oldest and largest private cancer hospital. And as of 1971, it was designated by the U.S. National Cancer Institute as a comprehensive center. And today, in our cancer center, we treat over 400 subtypes of cancer with over 1,000 physicians taking care of cancer patients. And we have about 23,000 inpatient hospital admissions and 600,000 outpatient visits. We not only take care of cancer patients, at MSK we also are at the forefront of developing novel way of taking care of cancer patients, from finding cure to addressing the psychosocial symptoms of cancer. We have over 100 laboratory investigators, 200 PhDs, MD PhDs, 400 research fellows, and at any given time there was over 500 clinical trials in the treatment of cancer or addressing cancer-related symptoms. So in this setting, this gives to the birth of integrated oncology, because many cancer patients utilize traditional and complementary medicine, and at that time there was not very much known how best to bring this together with conventional cancer treatment. So at MSK, we established a Society for Integrated Oncology. I had the honor to serve as the president in the last 2 years. In 1999, our service was established by Dr. Barry Kaslis as the first integrated medicine center in the Western world. And over the last 20 years, we have grown from 10 staff member to over 60 for staff. We provide a range of services, including acupuncture, massage, mind-body treatments such as meditation, tai chi, yoga, as well as lifestyle consultations on exercise, diet, and sleep. And we also have one of the largest music therapy program. We're not only treating adults, we're also treating children with cancer. We have martial arts as well as dance multisensory therapy for children with cancer. So over the last 10 to 15 years, there have been substantial growth in integrated oncology. This last year, we have the first time defined the field integrated oncology as a patient-centered, evidence-informed field of cancer care that utilizes mind and body therapies, natural products, and lifestyle modifications from different traditions along conventional cancer care. Integrated oncology not only aims to optimize health, quality of life, and clinical outcomes, but also empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. So two important words here are patient-centered and evidence-informed. So let's talk about evidence-based medicine. So evidence-based medicine was established in the 1980s, defined by integration of best available research evidence with our clinical expertise and patient values and circumstances. So clearly we need to understand that research evidence is not interpreted in isolation, has to be incorporated based on patients' preference and values, as well as clinicians' own clinical experience. So using that as a framework, I've been launching a framework of research in acupuncture for symptom management. As we know, cancer patients experience a lot of complex symptoms such as pain, fatigue, cognitive changes, not only during active treatment, but into survivorship as well as palliative care. And these symptoms are not just biological, they're driven by not only the disease of cancer, but cancer treatments and psychosocial context of the patient. Looking at treatment in particular, surgery, chemotherapy, radiotherapy, targeted treatments, hormonal treatments, as well as novel immunotherapies, they have the benefit of treating cancer, but unfortunately many of those treatments have substantial toxicities that make patients quality of life decrease, as well as making a lot of patients have to stop life-saving cancer treatment prematurely. My particular area of research focuses on addressing hormonal treatment. So I'm going to give you a case. This is a patient, Anna. She was a 45-year-old woman with stage 2 breast cancer. She had surgery, radio, and chemotherapy. Her menstruation stopped during chemotherapy. She also had to remove her ovaries to prevent cancer recurrence because she had a BRCA mutation. So she was experiencing about 10 to 15 hot flashes a day, waking up about 3 to 4 times a night. And she complained daytime fatigue. She took a medication called venlafaxine as recommended by her doctors, but she felt make her emotional, moody, and also decrease her sex drive. So she stopped after a few weeks. On physical exam, her blood pressure was normal. She had an essentially normal exam, but she was anxious. She also was having hot flashes right in front of me in the clinic, and she was very embarrassed. So let's look at how to use an evidence-based framework to treat this patient, incorporating clinical experience, preference, values, and research evidence. So this is a fairly young woman with breast cancer. She had premature menopause, and she experienced very frequent hot flashes and need additional anti-hormone treatment for her breast cancer. So let's look at what we know about hot flash. Hot flash is very common and debilitating in women with breast cancer, can be ranged between 30 to 60%. And often it's brought on by premature menopause induced by chemotherapy, as well as surgery removal ovaries. And the systemic anti-hormonal treatments such as tamoxifen and aromatase inhibitors can further make the symptoms much more severe and persist. And many epidemiology research have shown that women with hot flash tend to experience a much longer duration and severity than menopausal women going through menopausal transition. So the gold standard for treatment of hot flash is estrogen-based therapy. However, is contraindicated in patients with cancer. And there's a range of non-hormonal based treatments such as venlafaxine, citalopram, paroxetine, gabapentin, pregabalin, and clonidine have all shown to be efficacious compared with placebo. Gabapentin, a type of drug also often used to treat neuropathy, has shown to be effective for treatment of hot flash, particularly at a higher dose of 900 milligram. And venlafaxine 75 milligram is an antidepressant, has similar outcomes than gabapentin, but has a better tolerability. And in the United States, venlafaxine is probably the first-line treatment for oncologists to treat hot flashes. However, this particular patient was tried on this drug, had side effect, and she was also hesitant to start the anti-hormone treatment, which is really important for cancer. On top of that, she experienced sleep and mood disturbance and fatigue. So let's look at how patients would like to incorporate acupuncture for management of hot flashes. I received funding from the American Cancer Society to conduct a qualitative study, interviewed 25 women with hot flashes. We used the grounded theory to identify a range of themes that patients express as relate how they make decisions about treatment of using acupuncture. The patient has to perceive acupuncture is beneficial, and they also need to get endorsement and the decision support from their families and their doctors. And there are practical barriers such as cost, distance, and finding a good acupuncturist can potentially prevent patients from using acupuncture. But two important concepts. One is a lot of patients really see acupuncture as a natural alternative to drugs. And also patients have to experience significant symptom burden to want to commit the time and the cost associated with acupuncture. Here are some of the patient quotes. I hate taking pills. I have enough of them to take as it is. Another patient said, because I think I'm a cancer patient who has had cancer and have been treated by very invasive means, surgery, chemotherapy, radiation, you don't want another foreign object, she meant taking another medication in your body. And I'm not a person who likes to take meds, so I think acupuncture will be a little bit more natural for you. Last but not least, it's very common in the United States because many women are taking multiple medications for their blood pressure, diabetes, or other medical conditions. So because I'm taking enough medicine now, I take 6, 7, 8, 9, 10 pills a day. You know, that's just too many pills. So a lot of patients don't necessarily want to take a pill. It's not because of the pill, because they're just taking way too many medicine. They want something more natural. So clearly, preference for natural therapies is one of the major reasons why individuals choose acupuncture. Let's see where the evidence is. So in 2015, my group has conducted a large randomized controlled trial on electroacupuncture versus gabapentin for hot flashes. So we have 4 arms, basically electroacupuncture and sham acupuncture. Both groups were treated for 10 treatments over 8 weeks, twice a week for the first 2 weeks, then additional 6 weekly treatment. And then gabapentin group took 900 milligram of gabapentin, and so was the placebo group, took 3 pills a day. We used a primary outcome as a hot flash composite score measured by daily diary and used mixed effect modeling. So how to blind acupuncture is a very controversial topic in the area of acupuncture. We use the Streiberger technique. Essentially, on this side, I was holding the real and the sham acupuncture. But upon contacting the skin, the sham needles retract to the handle. So given the shortened appearance of the needle, so patients thought the needle may have gone through. In reality, the sham needle, the tip of the needle was still very sharp, so it can create a sensory sensation, mimicking the needle penetration. So this is both an advantage because in our study we found an equal amount of patients guessed they got sham versus real. But the challenge of this design is the sensory input created by the needle can have a physiological effect. It's not completely physiologically inert. So among 120 subjects, the green line is the real electroacupuncture, and the blue line is sham acupuncture, red line is gabapentin, and pink line is placebo pill. So at the end of 8 weeks, the end of treatment, the real acupuncture had the best effect, followed by sham acupuncture and gabapentin, and the placebo pill group have the lowest effects. But what is very intriguing is then we follow people for additional 16 weeks, so a total of 24 weeks without treatment. At that point, electroacupuncture clearly was the best treatment, followed by the sham acupuncture, followed by placebo pill. And the gabapentin group, as patients stopped taking the pills, their hot flash was regressing to the baseline. So what it does tell is acupuncture can really produce side effects of bruising and some increased pain for one patient. And gabapentin, the most common effects were dizziness, fatigue, and headache. So clearly showed that acupuncture is not only effective, it's also safer than medications. And a year later, an Italian group randomized 190 group to acupuncture versus usual care. They found that acupuncture also reduced the hot flashes compared with usual care, and that effect was carried over for at least 6 months follow-up. So with these 2 trials, clearly we have some evidence that acupuncture is an efficacious and safe treatment for women who prefer a natural alternative to medication to take for hot flashes. So National Comprehensive Cancer Network is one of the world's leading clinical guideline group for cancer care. In 5 out of their 11 supportive care recommendations, they recommend acupuncture for adult cancer pain, cancer-related fatigue, nausea, vomiting, and to be used in palliative care and survivorship settings. So I was one of the reviewers for survivorship. This last year, we added hot flash as one of the recommended indications during survivorship. So clearly with research, we can move acupuncture from a traditional and alternative therapy into part of a standard cancer care through rigorous research and then through development of guidelines and dissemination of guidelines. And dissemination of acupuncture work, it also requires education. At MSK, we have online acupuncture training for community acupuncture to train them about how to treat cancer patients safely and effectively using the protocol we have studied. And this is the most recent research we published in the journal National Cancer Institute. We found in 47 national comprehensive cancer centers in the United States, the recommendation for acupuncture for symptom management has increased from about 58% to 89%. Essentially, all large US top cancer centers now recommend acupuncture for symptom management. So again, with research, we can and are able to show that acupuncture is now making into the leading cancer centers in the United States for important supportive and survivorship care methods. So I want to end my talk showing that if we can incorporate evidence from research into our daily clinical practice and incorporate patients' values, we can truly develop a patient-centered, evidence-informed use of acupuncture for oncology patients. Thank you very much for your time, and I welcome you to the United States for our Society for Integrative Oncology annual meeting.